Hello, I'm here to argue that dairy fat is not your enemy. I'm Miles Hassell. I'm an internist in private practice at St. Vincent Hospital in Portland, Oregon. And there's a lot of discussion about dairy fat for a variety of reasons. Many of us like foods with dairy fat in them: butter, cheese, milk, yogurt, kefir. And as a result, we're loath to dismiss them out of our diet. And yet we also acknowledge that if they're bad for us, we shouldn't be eating them very much, or if at all. And so where is the truth? Historically, by historically I mean in the last 10, 20, 30, 40 years, there's been this sort of consensus that saturated fat and dairy fat is bad for you, that raises your risk of heart attacks, strokes, perhaps other things such as cancer, dementia, diabetes even, and is inflammatory. And so the question is, are those claims true? And we dissect this more in our book, Good Food, Great Medicine, which you'll see at the end of this presentation. But we're just going to talk about the dairy fat and heart disease component today. If you look at populations that eat dairy fat, and so these are pretty much almost every population on the planet, and then you separate within those populations who's healthiest and who's not, historically, the societies, the subsets of societies that have included dairy fat in their diet, and this applies to whether you're looking at the Pure studies, the EPIC studies, the Nurses' Health Study, the Health Professionals Follow-Up Study, these different studies. If you look at the population within those studies that's the healthiest, you see that they all pretty much include a moderate amount of dairy in their diet, the Mediterranean diet studies. And these are not necessarily low-fat dairy. So then you say, if in this population set we don't see harm, why do people think there is harm? And of course, you can always find studies of different views. And once again, I will refer to our book where we lay out studies from both on both ends of the spectrum, those that say dairy fats are bad and those that say dairy fats are good, and we try to point out how you can rationalize those things. But let's look at one recent study. Actually, let me step back for a second. Let's look at some of the randomized control trials using Mediterranean style diets. And probably the best performed, arguably, would be the Lyon Heart trial, which compared people on an omnivorous Mediterranean style diet that included dairy fats, although low fat dairy, but they actually had a fair bit of dairy fat in their population, to a lower fat diet, and found after 4 years that those that were in the Mediterranean diet group that included dairy had 70% less heart events, 60% less cancers, and about 56% fewer deaths. So pretty dramatic, arguably one of the most dramatically beneficial interventions in heart disease ever. And so when we look at more recent studies, and I'm looking at a paper by Schmidt in the American Journal of Clinical Nutrition in 2021, what they did was they took 3 groups of people and randomized them to a 12-week trial. One group had very, very little dairy in it. The other group had moderate amounts of low-fat dairy. And the third group had high-fat dairy included in the diet. And they measured blood pressure and cholesterol over those 12 weeks to see if there's any significant change. And the answer was there was no significant change in this group over the 3 months of the trial. And so we would argue that overall the evidence shows that dairy fat and dairy foods in general, especially cultured dairy foods, which would be yogurt, kefir, and cheese, are not associated with ill health in patients who have an omnivorous dietary pattern, of which we propose that probably the Mediterranean diet has the best evidence. That these diets containing dairy actually have and the dairy foods in particular, have a really important range of nutrients that are really good for us, whether it's the calcium, the proteins, the vitamin K in the cultured dairy, and other components, especially the probiotic foods, that these are actually really beneficial for us. And third, they actually provide a pleasant aspect to our diet. They make life better. And so we do not see that a strong case can be made for removing dairy foods from the diet. Thank you.